Recognizing the signs of HIV in women, essential information. Imagine waking up every day wondering if your body is fighting a hidden battle. For thousands of women across America, this isn't just a scary thought. It's real life. In states like Florida, New York, and California, HIV affects over 20,000 women each year. That's nearly 55 women every single day learning they have HIV. Around the world, the numbers tell an even more troubling story. Nearly 19 million women live with HIV globally. In some African countries, young women are twice as likely to get HIV as men their age. These aren't just cold numbers. They're mothers, daughters, sisters, and friends. Why does this matter so much? Because when it comes to HIV in women, knowing the signs could save your life. Many women don't know they have HIV until years after they get it. By then, the virus has had plenty of time to damage their bodies. The truth is, HIV affects women differently than men. Our bodies respond in unique ways. And sadly, many women miss the early warning signs because nobody told them what to look for. Today, I'm going to change that. Let's talk about how HIV shows up in women, the stages it goes through, and why catching it early matters so much. The 3 stages of HIV infection. When HIV enters a woman's body, it begins a journey that happens in 3 main stages. Stage 1 is what doctors call acute HIV infection. This happens within 2 to 4 weeks after the virus enters your body. Many women feel like they have a bad flu during this time. You might notice a fever that won't go away. Your body might ache all over. You could get really tired or have bad headaches. Some women also get painful sores in their mouth or private parts. You might see a rash on your chest or back. Your neck or armpit glands might swell up and feel tender. These symptoms usually last for a few weeks and then go away on their own. Here's the tricky part, about 30% of women don't get any symptoms at all in this first stage. They feel fine even though the virus is spreading in their bodies. This is why testing is so vital even if you feel healthy. Stage 2 is called clinical latency. This is when the virus goes quiet and hides in your body. It might seem like nothing is wrong. You feel normal. You look healthy. But inside, the virus is slowly damaging your immune system. This quiet stage can last for many years, even up to a decade or longer for some women. During this time, you might notice small problems that come and go. Things like yeast infections keep coming back, periods that are heavier or more painful than usual, skin problems that don't heal quickly, getting sick more often than your friends. Without treatment, stage 3 eventually arrives. This is when HIV becomes AIDS. Your immune system is now badly damaged. Your body struggles to fight off even minor infections. Women with AIDS often lose weight without trying. They get fevers, night sweats, and feel tired all the time. They might develop rare infections or cancers that people with healthy immune systems don't get. Without proper care, this stage can be life-threatening. Why women experience HIV differently? Research shows that women face unique challenges with HIV. First, our bodies have higher levels of the virus right after infection compared to men. Studies from Johns Hopkins found that women with the same amount of HIV as men have a 1.6 times higher risk of developing AIDS. Second, many HIV symptoms in women get confused with other common female health issues. Yeast infections, pelvic pain, and menstrual changes happen for lots of reasons. This makes it easy to miss them as possible HIV signs. Third, hormonal changes during a woman's monthly cycle can make HIV symptoms worse at certain times. Scientists at the NIH found that female hormones can affect how the virus behaves in a woman's body. Women-specific signs to watch for. While some HIV symptoms are the same for everyone, women should watch for these specific signs. 1. Vaginal yeast infections that don't go away with regular treatment. One study showed that nearly 70% of women with untreated HIV get chronic yeast infections. 2. abnormal pap smears showing cervical cell changes. HIV makes women 5 times more likely to develop cervical problems, including cancer. Pelvic inflammatory disease that becomes severe or keeps coming back. Research at the University of California found PID is more common and more serious in women with HIV. 3. Menstrual changes like missing periods, lighter periods, or more severe PMS. About 30% of women with advanced HIV notice these changes. Unusual vaginal discharge or sores that don't heal. These can be signs that your body's fighting systems are weakened. The window period and testing. If you think you might have HIV, getting tested is the only way to know for sure. But timing matters. Most HIV tests look for antibodies, the fighters your body makes to battle the virus. The window period is the time between when you get HIV and when tests can find these antibodies. For most modern tests, this window period is about 2 to 4 weeks. Testing too early might give you a false negative result. This means the test says you don't have HIV when you actually do. For the most accurate results, get tested 3 weeks after possible exposure, then again at 3 months. There are different kinds of tests. Rapid tests that use a finger prick or mouth swab, and results are given in 20 minutes. Lab tests that use blood from your arm give results in 1 to 2 days. Home tests you can do yourself give results in 20 to 40 minutes. The good news is that most tests today are over 99% accurate when done at the right time. Hope on the horizon, current HIV research. Now for some good news. American research centers are making amazing progress toward better treatments and even cures for HIV. At the National Institutes of Health, researchers have found ways to make HIV treatment simpler. Instead of taking pills every day, some newer treatments only need to be taken once a month or even less often. The University of California, San Francisco is studying women's immune responses to find better ways to protect them from HIV. Their work shows that certain immune cells in the female reproductive tract might be key to preventing infection. Perhaps most exciting is the work at American Gene Technologies. They're testing a one-time gene therapy treatment that could function as a cure. This approach changes the DNA of immune cells to make them resistant to HIV. Early results show these modified cells can survive and multiply in patients' bodies, fighting the virus naturally. In February 2023, they shared data showing their therapy eliminated HIV in 5 out of 7 patients in early trials. While still experimental, this gives us real hope for a future without HIV. Elite controllers, nature's clue to a cure. One fascinating area of research focuses on elite controllers, rare people whose bodies naturally control HIV without medication. About 1 in 300 people with HIV are elite controllers. Scientists at MIT and Harvard have found that elite controllers have unique immune systems that trap the virus in inactive parts of their DNA. By studying these special people, researchers hope to develop treatments that help everyone's bodies fight HIV the same way. Living well with HIV. While we wait for a cure, it's important to know that HIV is no longer a death sentence. With proper treatment, women with HIV can live long, healthy lives. Modern medications can reduce the amount of virus in your body to undetectable levels. When this happens, you can't pass HIV to others. This concept, called U equals U, also known as undetectable equals untransmittable, has changed how we think about HIV. Many women with HIV have healthy pregnancies and babies without HIV. They have successful careers, loving relationships, and full lives. The key is early detection and consistent treatment. Closing thoughts. Knowing the signs of HIV in women isn't just about protecting yourself, it's about protecting your dreams, your future, and your loved ones. By understanding how this virus works in women's bodies specifically, you gain power over it. If you notice any of the signs we've talked about, don't wait. Get tested. And remember, testing for HIV should be a normal part of women's healthcare, just like mammograms or pap smears. In the fight against HIV, knowledge truly is power. And the more women who arm themselves with this knowledge, the closer we get to a world where HIV no longer threatens us, our daughters, or our sisters. Be informed. Be tested. Be empowered.